severe hemophilia A is an inherited or genetic condition where there is an absence of a protein called factor VIII that is necessary for the normal process of blood clotting. So patients who have hemophilia A can have severe, debilitating, and/or life-threatening bleeding or hemorrhages into joint spaces like ankles, knees, elbows, shoulders, hips. They can also have bleeding into spaces like a brain, an airway, or body cavity that can be life-threatening because they have the absence of this factor VIII protein. Patients who live with severe hemophilia A can only replace the factor VIII protein that's missing by infusing it intravenously. That means putting the protein directly into a vein. So patients, as we speak, as young as 7 years of age, or at home, they've been taught to infuse this intravenous product at home to prevent bleeding episodes. Those infusions typically last over 3 to 5 minutes when they're done. It takes them 5 to 10 minutes to set up. These infusions then are infused sometimes daily, sometimes 3 times a week, sometimes every other day, and that's just to prevent bleeding. Gene therapy helps these patients in that we have an infusion, a single one-time infusion of the functional factor VIII gene that then can secrete in a more continuous way the factor VIII protein that's missing. So in a lot of patients, that can reduce the bleeding episodes that occur. It can also decrease those frequent infusions that are needed for prophylaxis or to prevent bleeding. We have a gene therapy that is available. It is FDA approved for patients living with severe hemophilia A who are 18 years of age and older. It is called Roctavian. Patients, again, who receive this product called Roctavian, who are living with severe hemophilia A, will have the benefit of receiving the actual functional gene that's missing and have an opportunity to potentially have a constant or steady state secretion of the protein that's missing, factor VIII, and can potentially have an opportunity to have decreased bleeding episodes. And as I mentioned before, the decrease in terms of the frequency of those infusions, which can be very burdensome for patients. You can get more information if you're living with severe hemophilia A, always from your hematologist or hemophilia treatment center near you. You can also get more information at roctavian.com. That's roctavian.com, ROCTAVIAN.com.